The Community Health Education Program is a program within Children's Emergency Department at United Medical Center that focuses on educating parents of children who come in for ambulatory sensitive care issues, which are non-emergent conditions, such as fevers, ear infections, sore throats. When a family first presents in the emergency department, they're triaged, so they're checked in and find out what their primary complaint is. From there, they're giving an acuity level, which basically tells the level if it's non-emergent to an emergency. The non-emergent issues are then sent to us. The ED physicians or nurses will let us know when there's a child who comes in for one of the ambulatory sensitive conditions. And we go to the family and just kind of talk with them and see what are their barriers, why are they utilizing the emergency department versus their primary care physician office, what are some of the issues that they're facing at their primary care physician's office. Is it that they couldn't get an appointment? Does the physician not do walk-ins? And we just kind of have a conversation first with the family. From there, we educate them on how to manage the condition at home, see if they have the necessary resources to manage the condition at home, or if we can provide outside resources to them.
I came to United Medical Center about 2 months ago. My daughter was diagnosed with bronchial spasms. They took great care of Jalen. And about 3 weeks after Jalen's visit, I received a call in reference to how she was feeling. And I was really shocked because that had never happened from a hospital before.
I look forward to helping families. I think that brings me the most joy working with my job and working with the program, to find that some of the families will call back and just say that it was great to get a follow-up phone call from someone, or the service we received is excellent.
I just think that it's really, really important to make parents feel comfortable and knowing that they have people in the medical field who are really genuinely concerned about the health and welfare of others. And if I needed to ask any question, if I was not familiar with some things, that I could go to them and in reference to what Jalen had been diagnosed with.
My experience was my daughter was complaining about a backache, and I noticed, she had this cough. The young lady came to, identified herself as a community health educator. She just told me about a variety of things, such as things in the home, that to watch out for as far as children, and as far as this type of ailment that my daughter had. Some of the things I think I kind of knew or whatever, but there's some other things she had mentioned it, I didn't see or pay attention to. I'm kind of looking at it, through a narrow sight. I'm looking at my daughter and what's actually going on with her, as opposed to what's going on around her. And then when she was telling me the few things she educated me about, it made sense to me. She did talk to me about the primary care physician. I took her to the primary care doctor after leaving here as a follow-up.
The primary goal of the Community Health Education Program is to make sure we're able to link parents back to their child's pediatrician. The primary focus is just making sure that they have a wonderful working relationship with their child's pediatrician, because the pediatrician is going to be the one that has the health history.
I believe there is an extensive amount of benefit that the community will get from the Community Health Education Program here at UMC. One being just that by connecting back to a medical home, you're receiving comprehensive care. That's something that you're not going to receive by solely going to an emergency department. Your primary care physician has all of your medical records and knows your child's history. If you just present into an emergency department, we aren't aware of these, conditions that may be going on with the child. But also, families are getting one-on-one education with the health educator.
There's something new and different that happens every day. Whether that's a parent who comes in and they don't know anything about what to do, or a parent who comes in and they're on the ball with everything, they just need some reassurance. I just like that every day is different, and you know that you're able to make an impact in someone's life.